Okay.
All right, Jahana. First of all, thank you so much for your time. I really appreciate you joining us. Um, America woke up this morning a nervous nation. Connecticut residents woke up a little more nervous than they were the day before. The Governor Ned Lamont today called this a reality check. You've been going through your own reality check. What are your thoughts this morning after hearing about POTUS and FLOTUS testing positive?
Well, first of all, like I said, I wouldn't wish this on anybody. So I hope that I pray that the president, the first lady, all of the staffers, their family around them are well. And if anyone who does test positive, I hope that it is a mild case. But none of this surprises me. And this is what I've been trying to say all along. And for me, even recovery is not a straight line. I had several really good days. And then yesterday and today, I woke up exhausted and again, struggling to breathe. And if anybody thinks that we're through the woods or turning a corner or everything is fine, then they're not paying attention. And I think probably the thing that bothers me the most, the moment I heard from my staff that she tested positive, I took this as seriously as I could. I called all of my staffers. I contacted organizers at events that I had stopped by. I pulled down all the events of the day. To hear that there's this area of gray where events continued and reporters were not made aware really shows that until we face this head on and share and are transparent and share the information, we can't stop it.
Congresswoman, I wanted to read you a text or a tweet rather from your colleague in the Connecticut delegation, Senator Chris Murphy. He said, everyone in the Capitol complex needs to be tested. Every Republican senator or staff member who was in close contact with Trump needs to quarantine. No business should proceed in the Senate until we understand the scope of this crisis. Would you agree with that?
Absolutely. That's what I said 2 weeks ago. That's what I've been saying up until now. So once again, in everything that happens, we have to look for the opportunities. And I think this is an opportunity for us to get it right. My staffers had such a hard time getting tested. The idea that as a member of Congress, I had a hard time getting tested. We are not regularly tested when we fly in, and you have people from all over the country. Some of my colleagues are coming in from hot spots, and we go on the floor and we vote. There's no temperatures being taken. I mean, yes, anecdotally, you can make an appointment with the House physician, but there's no plan for staffers. There are literally thousands of staffers on the Hill. I had someone in DC who had to drive to Virginia and pay $275 out of pocket for a test. We need a plan. And the plan is not just about testing. The second part of that plan is contact tracing, making sure that everyone who came in contact with someone who has a positive test result not only has access to a test, but has access to speedy results that are accurate.
You know what I wanted to ask you, Congresswoman? I know that you were a teacher and that education is near and dear to your life. Teachers are back at school now. You've been afflicted with this virus. You know what it's like. Does that make you nervous? Should we be back in school in person learning?
Matt, I am a teacher. I always sink a little when someone refers to me as I was a teacher. And no, we're not there yet. Teachers should not have to even make the decision of, is it safe to go back and teach or potentially expose my family? Like I said months ago, everybody wants schools to open, but we need to do that safely. We need funding for state and local governments. We need to make sure that the crumbling infrastructure in some of our oldest buildings that have poor air quality is addressed. And everybody, yes, schools are open, but I live in the state and I see every day, a couple times a day, even more times a week, where a school is closed for 2 or 3 days for cleaning, or someone's been exposed, that's not tenable. That's not a plan to just close every couple days. So this patchwork approach to a national strategy is not working. So I don't know how many more examples we need of that. Um, I, I know for me, it got really real and really personal when it hit home. So maybe now that it has hit home for the leader of the free world, we'll start to think really clearly and make sure that as he wants his family to be protected and safe, that we will extend that same courtesy to all other families.
What do you want people to know about this virus, the journey that you've been going through? I know that you committed early on to sharing this experience very publicly. You've been doing a lot of journaling. What have you learned personally going through this experience?
That is scary. That's probably the most important. It's so scary because you really don't know what to expect. I've had people from the Department of Public Health call every day. And this morning when she called, she said, "You sound different today." And I said to her, I says, "I'm heartbroken because I had some really good days and I thought I was on my way. And now today, it's like I took 3 steps backwards." And she said, "That happens sometimes." So I think the isolation of it, the uncertainty of it, um, just the ripple effect, because it's not just your health, it affects every relationship, it affects your work. It's everything around you is affected by the way we address the scope of this virus. So people need to take it seriously. I'll just say that in my own office, just working off of my own experience, I had a staffer who tested positive, and then within that family, within that staffer's immediate family, 2 other members tested positive, and then of course me. We sat in on a hearing together. But I also had 25 staffers who were negative. And I know that that's because of all of the precautions that we took and people wearing masks and following the guidance. And we need to take this seriously. We need to take this seriously because if we can reduce the number of people who are exposed and carrying that out into the community unknowingly, then we can begin to get a handle on this.
I want to let you go, and again, I appreciate your time, but I did just want to ask you briefly about a very important piece of legislation that the House just passed, the updated HEROES Act, which would provide another round of direct payments to the American people at a time when there's still a very high level of unemployment. So tell me what that bill what that bill would do, why it's important, and what are the prospects of it actually becoming law?
I'm so happy that we came up with another updated version, and it really has a lot of the same provisions. It just changes the timeline because things have changed over time. Um, it's unfortunate that the first HEROES Act wasn't passed because when we looked at the impact of COVID, we took it from through the lens of every perspective of all the constituents that we were hearing from, whether it were entertainment, small business, the post office, healthcare, schools. It was everything. You cannot address one thing without the other. You can't address homelessness without addressing food insecurity. So that's what we looked at. And the fact that we had to come up with even a second plan is unfortunate. It is unconscionable that the Senate is just stalled and not even hearing the bills. There has to be some collaboration, some communication, some sense of not stopping until we get to a place where we can agree. But I, I can't comment on why the Senate is not moving it. Maybe their constituents, maybe they're not hearing the same things that I'm hearing, but everybody in my district is hurting and needs some type of federal relief just to sustain them until we can get healthy again.
Congresswoman Jahana Hayes from the 5th Congressional District here in Connecticut, I wish you a speedy recovery, good health, and thanks again so much for your time.
Thank you. Talk to you soon.
Take care.